Employer-sponsored coverage. Healthcare coverage is not automatic in the United States, and there is no single system that covers everyone. Instead, most working age adults get health coverage through a job. This is called employer sponsored coverage. Others get their coverage through federal or state marketplaces or through government programs such as Medicare, Medicaid, the military, or federal or state employee programs. Around the time of World War II, employers began offering healthcare coverage as a way to attract workers. In the decades since, a job has become the most common way adults 18 to 65 get health insurance. For many individuals and their families, work provides more than a paycheck. It enables access to doctors, hospitals, prescriptions, and financial protection against high medical bills. When they offer health insurance as a benefit, employers must pay the majority of the monthly premium, and employees pay the rest through payroll deductions. That shared cost helps make coverage possible for millions of households. But even with employer support, coverage can still be expensive. Beyond their share of the premium, workers often face deductibles, copays, and coinsurance when they receive care. This can add up to thousands of dollars before insurance fully covers the allowable costs of care. If an employer provides healthcare coverage benefits to its employees, it may offer only one plan or multiple options. Upon starting employment and each year during open enrollment, employees must decide whether or not to enroll, whether to include other family members, often at additional cost, and when choices exist, which plan to select. Some plans have lower monthly premiums but higher deductibles. Others have higher premiums but lower copays and coinsurance costs. The out-of-pocket maximum, or MOOP, limits the total amount that individuals or families are responsible for in covered services in a given plan year and can vary by plan. These choices affect a family's financial risk for the entire year. Once a plan is selected, it usually cannot be changed until the next open enrollment period. However, major life events such as marriage or having a baby can open a short window to enroll or make changes. This is called a special enrollment period. Some employers offer health spending accounts, such as health savings accounts, HSAs, flexible spending accounts, FSAs, or health reimbursement arrangements, HRAs. HSAs and FSAs allow workers to set aside pre-tax dollars to help cover medical expenses. HRAs are tax-free accounts established by employers to reimburse employees for qualified medical expenses and sometimes premium costs. These programs can lower healthcare costs, but they do not replace health insurance. Because employer-sponsored coverage is so common, people can feel it is secure. They may make career choices based on access to coverage or stay in jobs, partly or entirely, to keep their health benefits. At the same time, job-based coverage can be lost when employment shifts. A reduction in hours, a job change, retirement, a move into contract work, or even a move to another geographic area can affect eligibility or coverage. If someone does not have access to affordable health insurance through their job, they may need to look for coverage elsewhere, such as the marketplace, Medicaid, or Medicare. Eligibility for those programs can depend on income, age, location, health status, or a combination of factors. There is no coverage guarantee. Employer-sponsored coverage plays a central role in the U.S. healthcare system. It ensures millions of adults and children and provides some protection against high medical bills. However, because it is tied to employment, access to care depends on maintaining that connection, which creates uncertainty and vulnerability in coverage. The structure of healthcare coverage in the U.S. shapes how people experience healthcare and what happens when work or life circumstances change.